गुड इवनिंग, नमस्ते, खुशामदीद। फिर हम आपके सामने हाजिर हैं डॉक्टर केकेज़ मेड टॉक्स का एक और एपिसोड लेके। मैं आपकी होस्ट और दोस्त डॉक्टर विनी कांट्रू। मैं एक पल्मोनोलॉजिस्ट और क्रिटिकल केयर फिजिशियन हूँ इंद्रप्रस्थ अपोलो हॉस्पिटल्स, नई दिल्ली में। आज का हमारा एपिसोड 796 एपिसोड है। डॉक्टर केकेज़ मेड टॉक्स की शुरुआत डॉक्टर केके अग्रवाल ने की थी और ये लिगेसी हम कैरी फॉरवर्ड करने की कोशिश कर रहे हैं। हम आपके सामने लेकर आते हैं मेडिकल इंफॉर्मेशन जो आप सबके लिए बहुत ही अनिवार्य और यूजफुल साबित हो सकती है। इसी के उपलक्ष्य में हम ये सीरीज कर रहे हैं ईएनटी की डिजीजेस के ऊपर, जिसमें एयर, नोज और थ्रोट की डिजीजेस आती हैं। और डॉक्टर अश्विनी कुमार हमारे साथ ये सीरीज को आगे बढ़ाने में हेल्प कर रहे हैं। आज का हमारा टॉपिक बहुत ही अनिवार्य है, लेकिन उससे पहले चलते हैं हेडलाइंस ऑफ द डे पे। एक रिपोर्ट के मुताबिक ये कहा जा रहा है दैट लिफ्टिंग ऑफ चाइनाज लॉकडाउन कैन एक्चुअली लीड टू एंड किल अप टू 2.1 मिलियन पीपल बैक देयर इन चाइना। चाइना से जो भी न्यूज आती है उस पे इतना भरोसा करना हमारे लिए पॉसिबल नहीं है, क्योंकि हमने देखा है, हिस्ट्री बताता है कि चाइना की कोविड की न्यूज के बारे में हम कितना उन पे भरोसा कर सकते हैं और ये जान सकते हैं कि वहाँ एक्चुअल सिचुएशन क्या है, ये बहुत ही डाउटफुल है। It has been seen that there has been a surge in the number of COVID cases in USA, Japan, in China and other countries also. ये सर्ज जो होता है फ्लू के केस में भी विंटर टाइम पे होता है, क्योंकि ओवर क्राउडिंग ज्यादा होती है। लेकिन कोई वेरिएंट ऑफ कंसर्न निकल के आता है या नहीं, ये समय बताएगा। सबसे अच्छा तरीका, सबसे सतर्क तरीका और सबसे अनिवार्य तरीका मास्क पहनने का क्राउडेड प्लेसेस में। मास्क पहनने से ये इन्फेक्शन काफी अच्छे से प्रिवेंट किया जा सकता है और बाकी वायरसेस जिसमें कि फ्लू का वायरस भी आता है उससे भी बचा जा सकता है। Researchers have discovered a new biomarker method to diagnose severe heart complications from cancer treatment. इसकी डिटेल्स अभी नहीं आई हैं, आगे डिटेल्स जैसे भी आती हैं हम आपको बताते जाएंगे। WHO says that the potential China wave is a wild card for ending the COVID emergency. WHO के मुताबिक ये कहा जा रहा है कि चाइना में यदि केसेस बढ़ते हैं तो ये माफ कीजिएगा, एक वाइल्ड कार्ड के तौर पे भी एक दस्तक हो सकती है, क्योंकि जो बाकी वर्ल्ड की पॉपुलेशन है ऑलरेडी कोविड से अफेक्टेड है, लेकिन जो चाइना की पॉपुलेशन है वहां पे इन्फेक्शंस क्योंकि लॉकडाउन के कारण कम थे, तो वो एक ससेप्टेबल पॉपुलेशन है इस समय वर्ल्ड में, जो कि कोविड के इन्फेक्शन को एक्टिव रखने में ऑन द लार्ज हेल्प करेगी अगर वहां के लोगों को कोविड नहीं होता है। तो ये देखना पड़ेगा क्या ये साबित होता है एक वाइल्ड कार्ड कोविड की इमरजेंसी को कम करने में या खत्म करने में। G20 Finance and Health Task Force begin work on India's global health priorities for 2023। जैसे कि हमने देखा कि G20 की प्रेसिडेंटशिप मिस्टर नरेंद्र मोदी के पास में इस साल के लिए आई है, तो काफी काम हो रहा है उस एंगल पे और हेल्थ वहां पे एक प्रायोरिटी रहेगी। The NFHS 5 data reveals that 1 in every 2 women in India is anemic. The prevalence is around 57% in the non-pregnant women and 52% in the pregnant women. यानी कि 50 से ऊपर जो प्रतिशत हमारी महिलाएं हैं उनमें खून की कमी पाई जाती है और इसमें सबसे कॉमन होता है आयरन डेफिशिएंसी एनीमिया। हमारी महिलाओं में जो प्रेग्नेंट फीमेल्स होती हैं, यदि आयरन डेफिशिएंसी रहती है तो बच्चे की डेवलपमेंट में प्रॉब्लम आ सकती है। इसीलिए ये अनिवार्य होता है कि प्रेगनेंसी से 3 महीना पहले कई बार हम फीमेल्स को कहते हैं कि अपने आयरन लेवल्स चेक करें और उन्हें ऑप्टिमाइज करें और अपने हीमोग्लोबिन को कम से कम 10 या 12 के ऊपर की लेवल से रखें। चलते हैं हमारे आज के टॉपिक पे, जो है एयर इन्फेक्शन एंड एयर डिस्चार्ज एंड इट्स मैनेजमेंट, द टॉपिक ऑफ द डे। जैसे आप देख रहे हैं कि विंटर टाइम पे ये कांस्टेंट कफिंग और नैगिंग ड्राई कॉफ जो कि मुझे भी हो रही है, क्योंकि पोल्यूशन लेवल्स भी बहुत ज़्यादा बढ़ जाते हैं। कोल्ड एयर के कारण हमारी जो सांस लेने की नली है, वो सिकुड़ जाती है और कई बार साइनोसाइटिस की प्रॉब्लम जो है आगे आती है। इसी के साथ जो कनेक्शन होता है हमारे एयर और गले के बीच में, कई बार ब्लॉक होने से एयर के इन्फेक्शंस भी होने लगते हैं। इसके अलावा भी कई एयर के इन्फेक्शंस होते हैं। इसके बारे में और बात करने के लिए मैं बुलाना चाहूंगी डॉक्टर अश्विनी को। डॉक्टर अश्विनी कुमार,
गुड इवनिंग मैम, गुड इवनिंग।
गुड इवनिंग। हमारे साथ कनेक्ट हो गए हैं डॉक्टर अश्विनी और अपना समय हमारे साथ बिता रहे हैं। काफी समय से हमें इतने अच्छी चीजें सिखा रहे हैं। थैंक यू सो मच डॉक्टर अश्विनी फॉर ज्वाइनिंग अस टुडे।
थैंक यू मैम, इट्स माय प्रिविलेज मैम।
तो डॉक्टर अश्विनी कुमार जो हैं, ही इज अ कंसल्टेंट सर्जन इन द डिपार्टमेंट ऑफ ईयर, नोज एंड थ्रोट, head neck surgery and cochlear implants in the Indraprasth Apollo Hospitals, New Delhi. He finished his master's degree in ENT in the year 2014. He has been associated with Apollo Hospitals since 2015. He provides all the services in ENT but has a special knack and interest in rhinology, which is the science of nose. He has done fellowship in allergy and asthma and hands-on training in skin prick tests. He has presented various papers at the national and international conferences and has won many awards and accolades. Thank you so much for joining us today. आज का
थैंक यू।
हमारा टॉपिक बहुत इम्पोर्टेंट है। कान के इन्फेक्शन हमने देखा है, थ्रोट के इन्फेक्शंस काफी कॉमन होते हैं विंटर्स में। ड्राई कॉफ होती है पोल्यूशन के कारण, वायरल इन्फेक्शंस के कारण। एयर के इन्फेक्शंस हम कितने ज्यादा देखते हैं इस समय में या ओवरऑल पूरे साल में, और ये एयर के इन्फेक्शंस किस तरीके से होते हैं, क्या होते हैं?
गुड इवनिंग एवरीवन। ईयर इन्फेक्शंस जब हम बात करते हैं तो उनको हम दो दो भागों में डिवाइड कर सकते हैं, आउटर ईयर इन्फेक्शन एंड द मिडिल ईयर इन्फेक्शन। जो हमारा जो सबसे कॉमन रहता है, पेशेंट्स कमिंग टू आवर क्लिनिक विथ ईयर पेन एंड ईयर डिस्चार्ज and history of cold, and have a prior history of also ear discharge and everything. So we first of all see these type of patients who come for us for ear discharge and ear pain. So we first ask them the history in terms of how long has been the history of ear discharge and ear pain, and is there any history of hearing loss is there or not. So with the history, most of the things are clear that whether it's outer ear infection or middle ear infection, both ear infection can present with the ear discharge, but we have to differentiate between outer ear infection and middle ear. It's quite common. Out of 10 patients we see in our OPD, at least 30 to 40% have this problem of ear infection and ear discharge. It's very common. If you see, we have covered allergic rhinitis, and people have comorbidities with allergic rhinitis with ear discharge, and with sometimes they have history of decreased hearing also. In this type of cases, we see lots of patients in our OPD.
All right, so very common ear infections which can be problematic and it can even affect your hearing, ऐसा बता रहे हैं डॉक्टर अश्विनी हमें। क्योंकि ear जो होता है बहुत ही सेंसिटिव पार्ट होता है, जिसका काम सुनना होता है, साउंड को परसीव करना होता है। और उसी के साथ साथ हमें ये भी पता है कि एयर के अंदर की जो स्पेस होती है बहुत छोटी होती है। यदि इसमें इन्फेक्शन बनता है तो अगर पस पड़ जाती है तो उसे जगह नहीं मिलती निकलने के लिए। इसके कारण प्रेस होती हैं बाकी नर्व्स और वेसल्स वहाँ पे, जिससे कि प्रॉब्लम क्रिएट हो सकती है। तो एयर के इन्फेक्शंस डॉक्टर अश्विनी बता रहे हैं, दे आर वेरी वेरी कॉमन इन एलर्जिक राइनाइटिस ऑल्सो, बिकॉज ऑफ द फैक्ट वी डिस्कस्ड इन आवर प्रीवियस सेशंस ऑल्सो that there is a connection between the middle air and your throat and the tubing, which might get clogged or which might get a swelling, which can lead to ineffective ventilation of this middle air part, which can cause a lot of problems, infections, pooling up of secretions and fluid inside the middle air. So that is how it affects your overall functioning, your sound quality, as well as it can affect your ear in terms of having a pain or in your hearing also. तो एयर के इन्फेक्शंस क्या केवल वायरसेस कर सकते हैं या बैक्टीरियल या फंगल इन्फेक्शंस भी होते हैं? यदि ऐसा होता है तो क्या डायबिटिक्स जो कि हमारे देश में बहुत ज़्यादा तौर पे हैं, डायबिटिक पॉपुलेशन पीपल लिविंग विद डायबिटीज़ बहुत ज़्यादा है, क्या उनमें ये ज़्यादा कॉमनली पाए जाते हैं? यदि ऐसा है, तो किस तरीके के इन्फेक्शन मिडल ईयर इन्फेक्शंस डायबिटिक पॉपुलेशन में पाए जाते हैं?
Okay. So very good question, ma'am. So you touch a good topic. Um, Diabetes is a major problem in India. So most of our patients who are diabetic, their immune system is down. They are immunosuppressant basic. So in immunodeficient patients, so in this type of patients, the fungal infection is quite common. So we see more of a patients who have ear discharge, which is curdy white or like milky color discharge, and they have itching in the ear, which presents more of a outer ear infection, that is otomycosis. The fungal infection is very common in this type of patient, and the other very important ear infection, which every diabetes should uh, taken care of, is a malignant otitis externa, which is caused by a very dangerous bug, which is called Pseudomonas. And it's very hard bacteria, or very resistant bacteria to go away from the body. So in diabetic, we tell our patients not to do ear put earbuds or cotton buds inside to self clean the ear, because that can infect your outer ear canal and can lead to otitis externa, which is resistant form, that is called malignant otitis externa. So we should be very careful in this type of diabetic patients. And diabetes itself can affect the middle ear also. Persistent ear discharge with a perforation and all can have a very where the sugar level is very high and diabetes is poorly controlled. Then it is a very serious challenge for us also to look for a right antibiotic for the good amount number of days to cover up the infection. So this is regarding diabetes. Vinny ma'am also touch upon the otitis media with effusion, which is also very common in today's scenario, because we'll see lots of children with upper respiratory tract infections. They are coming with single-sided ear pain. So generally, what happens when they are having a acute respiratory tract infection, the virus and the bacteria can travel through the extraction tube into the middle ear. Middle ear being a very narrow space, it's hardly 0.3 to 0.5 ml space, and it's all surrounded by bony structures except the tympanic membrane. So there's a lot of congestion, a lot of fluid formation. Infection keeps on growing, and they start pressing on the tympanic membrane. The child will come to you with this very severe pain and a decreased hearing, because we see the physiology. The outer ear is having a air, and the middle ear is filled with fluid. So there's a change in the shift and medium. So when the sound travels from one medium to the other medium, it is the dampening of the energy. The children will present with a decrease, like muffled voice, that the sound is coming as if it's coming to the water, and the severe pain, and having a history of URTI. So then we should be very careful in managing this situation, because if you don't manage on right time, then the children can present with something called acute suppurative otitis media, when the discharge like bursts to the tympanic membrane and comes out into the outer ear canal. So catching the identification of a disease and awareness of the patient should also be there, so that both doctor and patient can uh, touch upon the topic and give a good result to the patients. So these are two things
जी।
which I wanted to highlight.
So, this is coming up as a fact that if a child has acute pain in the ear, they are saying that they are not able to hear the voices, especially in school, they are not able to hear it, they have pain in their ear. They have recently suffered from any upper respiratory infection. उन्हें अभी सर्दी खांसी जुकाम हुआ था, उसके बाद कान में बहुत ज़्यादा पेन हो रहा है, सुनाई कम दे रहा है। तो ऐसे बच्चे को चेकअप ज़रूर कराएँ अपने ईएनटी सर्जन से, क्योंकि इसमें खतरा रहता है उनके टिम्पैनिक मेम्ब्रेन, जो कि एक मेम्ब्रेन होता है जिसमें साउंड जो है स्ट्राइक करती है और वेव्स के फॉर्म में अंदर जाती है सुनने के लिए। तो टिम्पैनिक मेम्ब्रेन कई बार फटने के चांसेस रहते हैं क्योंकि अंदर पस फॉर्मेशन होता है। इसको एक्यूट सपोरेटिव ओटाइटिस मीडिया कहा जाता है। तो यदि ऐसा होता है डॉक्टर अश्विनी, अगर फट जाती है टिम्पैनिक मेम्ब्रेन तो उसके क्या कॉन्सिक्वेंसेस हो सकते हैं? उससे क्या फ़र्क पड़ेगा यदि ये मेम्ब्रेन फट जाएगा?
Okay. So, so the tympanic membrane acts as a like as the amplifier of the sound, because when the sound waves strike the tympanic membrane, it it amplifies the sound and transmit the energy to the through the ossicles, the malleus incus it is gone into the inner ear. So when the drum is ruptured, so the amplification of the sound will not happen. First, the first thing is this, the hearing will come down. Second thing, when you have a perforation, so tympanic membrane also acts as a barrier which separates your outer ear from the middle ear. So that barrier is lost. So anything like water going inside or the infection from the middle ear coming out, so it will keep on discharging. Your ear will keep on discharging, and you will have a chronic infection. So this acute suppurative otitis media, if not controlled well in time, can lead to something called chronic suppurative otitis media. So the periodic infection, the repeated infection of the middle ear can cause destruction of the hearing bones of the middle ear and resulting in a hearing loss. When the infection is very severe, it is not well controlled, then the infection can travel to the brain also, and can cause different complications meningitis. It can cause thrombitis or some facial nerve descents or some inner ear consequences we can have. So the disease earlier it is controlled, better for the patient and the doctors both actually.
एक तो हमने जाना कि पेन मिडल ईयर का बहुत कॉमन हो सकता है मिडल ईयर इन्फेक्शन में फीवर आ सकता है, हेडेक हो सकता है क्योंकि ये पेन जो है ट्रांसमिट होती है हेड की तरफ। इसके अलावा भी हमने देखा है कई पेशेंट्स आते हैं एक क्रॉनिक डिस्चार्ज लेके कि हमारे कान से काफ़ी ज़्यादा डिस्चार्ज आता है, पस बहती है। ऐसे पेशेंट्स में किस तरीके के इन्फेक्शन होते हैं और इसका मैनेजमेंट हम किस तरीके से करते हैं? जिन पेशेंट्स को ऑलरेडी जो है डिस्चार्ज बहुत ज़्यादा आता है मिडल ईयर से, उनके लिए कुछ बताइए?
हम्म सो ऐसे पेशेंट्स होते हैं जिनको मिडिल ईयर से डिस्चार्ज आता है क्रॉनिक. So these are chronic patients who had prior history of ear discharge, any childhood history of ear discharge. So these patients have past history of ear infection, and it has been long standing infection which has controlled with medication for some time. It was not permanently cured because surgery was not done to them to repair the tympanic membrane, because once you don't repair the tympanic membrane, that means it acts as a pathway to the water to go inside and the infection to go inside, because the barrier is lost. So these patients, when they come to us for a recurrent ear discharge and the discharge not settling down, so what as a OPD basis, we take the ear swab for culture sensitivity first, just to look for the bugs, what's bug it's growing. And we also take the history of diabetes or any other immunos deficiency state or not. We also get an audiogram done in this type of patient to see that how severe is the hearing loss. And if required, we also ask for HRCT temporal bone to look for the disease in the mastoid bones and how badly the ear has been affected. So on proper workup, we come to a conclusion. These are the bugs which are going, and these are the bugs which are sensitive to this antibiotics. The very fact is that we have to be very careful in giving ear drops in this type of patients, because some drugs are ototoxic medicines. So if by chance if we give some drugs which goes into the middle ear, can go into the inner ear through the round window membrane and can cause prolonged use of this medicine can cause hearing loss in this type of patient. So right selection of drugs. I request everyone not to go and buy medicine over the counter and can they go and कुछ medicine दे दो कान में डालने के लिए. This is a wrong habit to practice. Be very specific with your medicines, and take care of your ear discharge seriously, not to be taken lightly.
जी, ये बहुत कॉमन है क्योंकि जब भी किसी को इतनी क्रॉनिक इन्फेक्शन होती है, वो पहले तो लाइटली लेते हैं, उसके बाद जब उनका एयर में डिस्चार्ज बनता रहता है, तो किसी भी मेडिसिन शॉप पे जाके ऐसे बोलते हैं कि प्लीज़ हमें कुछ दवा दे दीजिए इस डिस्चार्ज को क्योर करने के लिए। और यूजुअली ओवर द काउंटर एंटीबायोटिक्स जो वो लेते हैं प्रोलॉन्ग्ड तौर पे विदाउट एनी सुपरविजन, उन्हें पता नहीं होता कब रोकनी है। उसके कारण जो है ये एब्ज़ॉर्प्शन होता है, अंदर के अंदरूनी एयर में जा सकता है और वहाँ पे ऑटोटॉक्सिसिटी यानी कि टॉक्सिक बन के वहाँ पे अफ़ेक्ट कर सकता है आपकी नर्व्स को, जिससे कि आपकी हियरिंग भी जा सकती है। तो ज़रूर सतर्क रहें इसके बारे में कि आप कौन-सी दवा अपने एयर में डाल रहे हैं और किसी क्वालिफ़ाइड डॉक्टर के लिखने पे ही ये सब दवाएँ अपने कान में डाल रहे हैं। बहुत ही कॉमन सिम्पटम्स होते हैं एयर इन्फेक्शन के। हमने जाना कि आउटर एयर स्पेस में एक्सटर्नल एयर इन्फेक्शन हो सकती है, मिडल एयर में इन्फेक्शन होती है। डायबिटिक्स में कुछ नेक्रोटिक इन्फेक्शंस बहुत कॉमन होती है, जिसमें सीडोमोनास के बारे में डॉक्टर अश्विनी ने हमें बताया। तो डायबिटिक्स को पर्टिकुलरली बहुत ही एक लेवल ऑफ जो सस्पिशन है और उनका थ्रेशोल्ड कम होना चाहिए डॉक्टर से मिलने में, क्योंकि इन्हें कई बार सीडोमोनास नाम के कीटाणु के लिए इंट्रावेनस एंटीबायोटिक्स लेने की भी ज़रूरत पड़ जाती है, क्योंकि इस कीटाणु को इरेडिकेट करना, जो हमारे पास ओरल मेडिकेशंस है, उससे कई बार प्रॉब्लम हो जाता है और इसमें एक प्रोलॉन्ग्ड थेरेपी की भी ज़रूरत होती है, जिसमें हमें मॉनिटरिंग करनी पड़ती है शुगर लेवल्स की भी, क्योंकि शुगर लेवल यही यदि इनकी एक ऑप्टिमल लेवल नहीं है, तो इन्फेक्शन ठीक होने में समय भी लग सकता है और कई बार ठीक भी नहीं होता है। हमारे साथ कई लोग जुड़े हुए हैं, मैं नमस्ते करती हूँ सबको। वंदना बोरा जी हैं, रत्नेश जैन जी हैं, कृष्ण गोपाल, डॉक्टर एन.एस. शारदा, करुणा प्रमोद, निर्मला गुप्ता, अंशु सिंह, अकील बुखारी, करुणा प्रमोद जी कुछ सवाल भी पूछ रही हैं, जो मैं अभी आपको पूछूँगी। केदार जोशी जी ने भी कुछ सवाल पूछा है। इसके अलावा जो भी लोग हमारे साथ जुड़े हैं, प्लीज़ अपना क्वेश्चन टाइप करिए। मैं एक-एक करके सब क्वेश्चंस लेने की ज़रूर कोशिश करूँगी। कृष्ण गोपाल जी हमें पूछ रहे हैं, उनके रिलेटिव को एयर इन्फेक्शन है, जिसकी वजह से उन्हें पेन होता है और कुछ स्क्रैचिंग या इचिंग होती है। इसके लिए क्या कर सकते हैं? यानी कि सिम्प्टोमैटिक ट्रीटमेंट पे अगर हम आएँ, एयर इन्फेक्शन में किस तरीके के हम जो है टैबलेट्स के ज़रिए या मेडिकेशन के ज़रिए इनको कंट्रोल कर सकते हैं?
Okay. So it's a very common tendency for every human being to put something inside the ear कि ऐसे करके कुछ key rings हो गए हैं या hair pins हो गए हैं, earbuds हो गए हैं, they keep scratching their ears. So what happens generally, this itching is a very common symptoms for patients coming and having a history of self cleaning or self uh, putting a earbuds, cotton buds. So when these patients, when they try to clean the ears, so rather than doing good, they are doing harm to themselves actually. So we have a outer layer in the external auditory canal that produces cerumen, which is an antibacterial, antifungal kind of a thing. So these things, when you try to remove, try to do itching or scratching, you remove the protective layer and you invite the bacteria and fungus to grow inside actually. So and most of the time in winters you have a dryness, and because of the somebody having a seborrheic dermatitis, dandruff issues, those can also cause itchiness and scratchiness in the ear canal. So the best thing I'll recommend to use something called lubricant. Either you can put a olive oil or a badam rogan oil, 2 drops. If the TM is intact, you can put 2 drops just to lubricate it, so that itchiness will go. So if you have a persistent itchiness, so try to see the underlying cause why you are having a persistent itchiness. Is it a dandruff which is causing a problem? Take care of the dandruff. And if you have some allergy issues, you can take some anti-allergic medicine SOS. But don't do any self-cleaning of the ear with earbuds or a cotton buds or put anything inside. So this is the recommendation what I generally give my patients, not to use anything for the ear self-cleaning. If you have a wax formation, too much of wax formation, um, and it's causing you a problem like pain, heaviness, and blockage, see a doctors, get it cleaned by a ENT specialist. Don't go and on and get it bad by getting it someone ill trained or under professional ear wax remover actually.
राइट। So Akil Bukhari is also asking a question. They're saying otorrhea accompanied with allergic rhinitis. What is the management?
Yeah. So very good question. Allergic rhinitis, because nose and the ears are well connected with the eustachian tube. So if you don't control your allergy, your ear is going to get affected every time. So otorrhea, because of the allergy, we can manage first allergy in terms of uh, using anti-allergic and washing and spray to control the nose part in terms of allergic conditions. And ear thing, like when you have a persistent ear discharge, we can give something called drops with a dexamethasone combination to make the ear dry and treat the underlying factor allergy and treat the ear thing both. So if you treat only the look into the ear thing as a otorrhea without treating the allergic rhinitis, the ear thing is going to get affected again and again. So first treat the nose, uh, take care of the allergy part by anti-allergic medicine or identification of the allergens by doing a skin prick test, going for the avoidance thing, or getting a immunotherapy done, or managing symptomatically by anti-allergic. And the otorrhea part, if you have a perforation in the ear, get it sorted by surgery um, after proper investigation and imaging done.
तो हम बात कर रहे हैं एयर इन्फेक्शंस के बारे में, उनकी मैनेजमेंट के बारे में। सामने आ रही हैं बातें, एयर इन्फेक्शन जब होती है, डिस्चार्ज होता है, उससे इचिंग होती है, तो बार-बार अपने कान में जो है ईयरबड्स डालने से जो वैक्स की प्रोटेक्टिव कोटिंग है, वो भी निकाल लेते हैं हम कई बार साफ करने से, क्योंकि इचिंग होती है बहुत ज़्यादा। तो इसको हल्के में ना लें, क्योंकि वो प्रोटेक्टिव लेयर यदि बाहर आती है, तो बहुत सारे तरीकों के इन्फेक्शंस हो सकते हैं। आप इनके लिए एंटी एलर्जी की मेडिसिन जो इचिंग कम करती हैं वो ले सकते हैं। इसके अलावा हमने जाना कि किस तरीके से हम बाकी मेडिकेशंस यूज़ करते हैं स्पेशली एलर्जिक राइनाइटिस में, और क्या तरीके हो सकते हैं इसे कम करने के लिए। डॉक्टर शारदा हमें सवाल पूछ रहे हैं कि ओटाइटिस मीडिया जो है, क्या वो काफ़ी लंबे समय तक रह सकता है विदाउट कॉज़िंग एनी काइंड ऑफ डेफनेस? यानी कि हमारे सुनने की शक्ति में कोई ज़्यादा असर ना पड़े, लेकिन हमें उसके बावजूद भी ओटाइटिस मीडिया हो सकती है?
Yeah. So otitis media, you have chronic otitis media, which is something called active and which is called aticoantral disease. When you have cholesteatoma in the middle ear, which is it's affecting the ear bone and can cause erosion of the ear ossicles, resulting in a hearing loss. Or sometimes they have a facial nerve paralysis and a vertigo. But when you have a safe central perforation, that means you don't have a cholesteatoma in the ear. So in those cases, if you can take care of the like avoiding water going inside your ear or controlling your respiratory tract infection, then you can go away with those without ear discharge and not much of a hearing loss if you have a very small perforation. But if the perforation is large, you will have some sort of a hearing loss, but you will not have a discharging ear if you have controlled with a good avoiding water going inside your ears or getting a cold and frequent colds and all. So these are two things. So we have a two kind of a chronic otitis media. It is like, one you have a cholesteatoma, which is called aticoantral disease, in which there's a bone erosion property, and that will obviously, it's a slow progressive disease which can affects your hearing bones and causing your hearing loss. Whether there's other type of hearing chronic otitis media, which is called safe central perforation, where you can have on and off discharge, and you can have a quiet period for quite a long time without any ear discharge and without much of a hearing loss. It's true.
जी। इसके अलावा करुणा प्रमोद जी हमें क्वेश्चन पूछ रही हैं कि रूमेटॉइड आर्थराइटिस की वजह से क्या एयर में पेन हो सकती है? और कुछ हियरिंग लॉस भी हो सकते हैं अगर किसी व्यक्ति को रूमेटॉइड आर्थराइटिस है तो?
So rheumatoid arthritis directly will not. There are many autoimmune ear diseases which can cause nerve hearing loss. That is called autoimmune inner ear disease, that is called it that. So it will not, rheumatoid arthritis will not as per se will cause hearing loss, but if he has autoimmune inner ear disease, it can present as a hearing loss. It will not cause otitis media or otitis externa, but it can affect the hearing nerves and can cause hearing loss. In these type of patients, some patients will have autoimmune disease. They can present with a otosclerosis also, and that can present as a fixity of the footplate of the stapes bone, and that can affect the hearing of the patient in terms of hearing loss.
जी.
And most of the times, these rheumatoid arthritis patients are on medicines which are ototoxic like methotrexate and all. They can cause a long use of these medicines can affect the hearing nerves of these patients. So we should be periodic assessment of hearing is very important in this type of a patient. Like once in a year, if they have a family history of hearing loss, they should get it done periodic hearing assessment and ear care. That what we always say: avoid ototoxic medicine, avoid loud music, loud sounds, and periodic assessment of hearing. That is very important in this type of patient.
राइट। एक सवाल जो कि मेरा सवाल भी है, काफ़ी कॉमनली हमने देखा है, केदार जोशी जी का सवाल है, नीला ठाकुर का भी एक सिमिलर सवाल है जो कि मैं आपसे पूछना चाह रही हूँ। कभी-कभी नाक साफ करने पे लगता है कि कान से भी हवा निकल रही है, क्या ये कान के पर्दे को नुकसान कर सकता है? वहीं नीला ठाकुर जो हैं वो पूछ रही हैं कि हाई राइज़ में लिफ्ट यूज़ करने से कई बार एयर में एक अनकम्फर्टेबल सेंसेशन महसूस होता है और मुझे पर्टिकुलरली कई बार ड्राइविंग के टाइम पे ऐसी सेंसेशन महसूस होती है जिसमें एयर चेंजेस कई बार होती हैं। अ, गाड़ी की खिड़की खुलती है तो कुछ एयर चेंजेस कि ये जो जिस चीज़ की बात कर रहे हैं मुझे भी फीलिंग कई बार आई है। तो ये सब क्या है? जब हाई राइज़ में हम जाते हैं लिफ्ट में, गाड़ी में बैठे होते हैं या अचानक ही कई बार जब हम अपनी नाक ब्लो करते हैं तो ऐसा लगता है कि एयर से भी हवा निकल रही है। तो ये क्या रिलेटेड है, अनयूजुअल है या हमें अलार्म होना चाहिए कि ये एक अच्छा सिम्पटम नहीं है और अपने कानों को चेक कराना चाहिए?
So the pressure change because station tube is a tube which connects your nasopharynx and into the middle ear. So that is a pressure equalizer basically. So it equalizes the pressure of the outside and the inner atmosphere. When we go high hills and the top mountains or the aeroplane when it's takeoff and landing, when the pressure change difference, the ear tries to equalize the pressure with the station tube. If somebody having a poor station tube dysfunction, that means station tube is not functioning properly. So in those patients will have some kind of a blockage sensation or block sensation. So suddenly you will feel that you pop your ear, you swallow something, you gulp some water, then your ear pops up and you start feeling better. So the station tube में अगर अगर एयर एंट्री अच्छे से हो रही है, अगर फंक्शन प्रॉपरली कर रही है, then you will not have a problem of this blockage or a popping sound kind of a thing. So we usually recommend that a person who are frequent flyers and having a ear pain while takeoff and landing or going high hills, we do a test called tympanometry or the pressure test of the middle ear. That is called impedance. So if it comes with a negative pressure every time, so it's good for them to have something called putting a ventilation tube put into the tympanic membranes to which equalizes the pressure of the outside and the middle ear until their eustachian tube start functioning normally. And to maintain the proper eustachian tube functioning, we always tell the patients to have something called Valsalva exercise. That's to try to close your mouth, close your nose, and try to blow air out like this so that the air goes inside the middle ear. So that eustachian tube, which is formed by the two muscles, so they keep it patent for a long time. So when you have good eustachian tube functions, you will have a less problem with the ears. And the air thing while driving and all, this is because of the uh, uh, excessive sensitivity of this ear for the air and sound things, which causes this irritation or also discomfort kind of a thing.
Right. So, also, we have talked about ear health, normal ear health. We know that we should be avoiding excessive high pitch sounds. We should not be causing a lot of, loud sound exposure to our ears. These are some of the healthy habits which everybody should follow. Do you have any other tips for us to follow for our ear health? And as you also told about the earbuds, inappropriate use
Yeah,
of earbuds. So, what are the
yeah.
healthy ear habits, so to say, for
Healthy,
everybody to
yeah.
follow?
Yeah, healthy ear habits starts from the home only. So, like, there's a saying, if you educate a woman, you educate a society, actually. So it's like, tell everyone, start from the childhood, not to use anything like finger also inside the ear, because the tips of the finger cause a lot of bugs and bacteria. So wherever you are putting inside your nose or inside the ears, you are putting an infection inside the ear. And no use of, like, somebody's had, like, putting a car key or the bike key inside the ear and keep doing it, like they feel like, it's like, maja aa raha hai, karte ja rahe hain, but they are actually causing harm to the ear. So uh, proper cleaning of the ear. Do not use anything inside. Whenever you're going for a shower, make sure that water should not go inside the ear. So because once the water goes inside the ear, and having a humid conditions, like, India being a hot and humid condition, the fungus tends to grow very frequently in this type of situation. So avoid water entry. No earbuds, no cotton buds, nothing inside the ear. That is overall protection for the outer ear. um, uh, Avoid exposure to loud music, loud sounds, okay, and not having a when you're using earphone or a headphones, your decibels should not be crossing 60 decibels, 70 decibel for a long time. Persistent standing in front of the DJ, like going in a party or music and all, that can have a sudden hearing loss in this type of patient. And if you are a factory worker, or you're working in a machinery, you should not be exposed for long hours at the same time, because persistent exposure to loud music can cause a high frequency hearing loss. So in this type of patient, they will not differentiate between a speech kind of a thing. So they will have a speech understanding issues. Like if I say socks and fox, they will not make it out clearly, because the the low frequency sound is a loudness. So loudness will be very clear, but the speech will not be that clear. They have a sloping type of hearing loss. So, like, you have this type of issues, then see a doctors, or change your profession. Like, you can take a break, small break, not standing for long hours, or use of a cotton buds, or like, you have a swimmer's bird actually when you are going for a swimming or kind of a thing, to protect your ear from the ear canal. Avoid exposure to loud music, loud sound. Avoid ototoxic medicines. So ototoxic medicines are not good. So we also send the information, like, what are the list of ototoxic medicines should be avoided. And excess salt should be avoided, because many a times we have seen that patients with a venous disease, the endolymphatic hydrops and all, they have vertigo, fullness, and the hearing loss. So salt intake has to be limited. Salt is anyway harmful for the heart, also for overall things. So you should be very careful. And caffeine intake should be limited, because caffeine can cause many times for chocolate, uh, caffeine, sometimes fizzy drinks. Um, Stress is the most important thing, and there's a recent studies which says that if you exercise, like, half an hour morning and evening, you are, like, protecting your outer hair cells. That inner ear has a hair cells which receives the sound. So it has a study has been done on the mice, that those mice who exercise, well, like, they have running and all those, so their hearing was well preserved. So I request everyone to keep exercising morning and evening, half an hour daily, so to preserve your hearing for a long time, and protect from the loud music and all. So these are the healthy habits. What we say, everyone, avoid junk food. That is for all. And MSG, monosodium gluconate, and all these things can cause migraine, and migraine can itself can cause vertigo in some kind of a patient. So overall, these are the things, ma'am, what I can think of. If something comes more, I'll tell you.
So, we have learned a lot about healthy ear habits, which you have enumerated in a very nice manner, including how we can take care that we are not allowing any kind of loud noise to get into our ear, and also use of these earbuds to clean. Durg, Dr. N.S. Sharda is also asking about the air pressure changes which we were discussing earlier, that क्या एक कॉटन प्लग लगाने से, जैसे हमने देखा है एयरप्लेन में ट्रैवल करते टाइम कई लोग एक कॉटन प्लग रख लेते हैं टू प्रिवेंट द एयर प्रेशर चेंजेस, क्या ये चीज हेल्प करती है?
No. So what happens? We have discussed this station tube basically equalizes the pressure. So when you are putting a cotton or inside the ear canal, so you are not allowing the loud sound to get air inside the ear. But if you want to be away from this thing, so what I suggest, when you have a station tube dysfunction, you start decongesting your nose. That means like before takeoff and landing. So one day prior and before takeoff landing, use something called oxyxylometazoline spray. So that will decongest your nose. Or chew chewing gums. Okay, when you are chewing gums, you are making your cesium tube patent. Or take a sip of water. So these are three things, like a few things which you can get away with the cesium tube dysfunction or the blockage in the pressure change, that what happens in the
You're right.
ear.
So we spoke about the perforation of the eardrum. If there is a perforation which needs to be sealed, which you touched upon, are there any surgeries available for these kind of problems? And if somebody has already suffered a hearing loss due to any kind of problem, whether it was the infection or the eardrum problem, can we help in terms of any hearing aids? On the same lines, Karuna Pramodji is asking how to communicate with people with hearing loss. जोर से बात करनी है या कोई स्पेसिफिक तरीका है ऐसे लोगों के साथ, उनकी कंडीशन के साथ डील करने में, स्पेशली जो एल्डरली लोग होते हैं उनसे?
Yeah. So hearing loss is a when you don't hear, you don't communicate with the people actually. So uh, when a person is having a hearing loss, so we do a audiogram, and we also do something called speech audiogram, which is not commonly done in everywhere. So we try to see how much is the hearing loss. This is a mild hearing loss. 10 to 20 to 30 dB loss is 30 to 50 moderate, or 50 to 70 is severe, and more than 70 is a profound hearing loss. So if a person is having mild hearing loss, he can get away with not much of a problem. But if a person is having a moderate to severe hearing loss, it will affect his day-to-day activities. Many times we have seen that person avoiding going into the social gatherings. They don't go to the kitties and all. They start saying isolating themselves. And if a hearing loss is not touched upon for a long time, person can go into depression also, because they don't communicate with the people. So if it's a sensory hearing loss, if a nerve thing, there is no medicine for that. So you will have to use something called hearing device or the sound amplifier, so that can amplify the sound and can put inside the ears, and you can hear well. But when you have something called perforation in the ear, and you have a nerve loss also, that's called mixed hearing loss. So if you can repair the drum, and your nerves are fine, then you can start hearing well. So we do a surgery which is called tympanoplasty, in where we repair the drum. We take a fascia from the muscles and we repair the drum. It can be done under local also. It can be done in general anesthesia also. We can do end oral also. We can do post oral also. If someone is very concerned about the cosmetic issues without having a scar, so we do repair surgery. It's a half an hour to 45 minutes procedure. Very well rewarding surgery, and the person gets a lot of benefit after getting a surgery done. So in terms of his ear will not get discharged, and the hearing will also get improved. So that is called surgical wise. And if it's a nerve hearing loss, then this surgery has not much of a role. We advise for the hearing device, but if a person is having a severe to profound hearing loss, in this type of a patient, the hearing aid might not help. So in this type of patients, it's a postlingual subs profound hearing loss. We do something called cochlear implant. So cochlear implant can give you a very good result in terms of a hearing, where the hearing aid might not help you. And in children's who are born with a bilateral profound sensory hearing loss, which have no words and speech and all, the cochlear implant is a boon for them. Actually, it's a great thing which the science has found out, to give a hearing to a deaf and dumb child, because जो बच्चा सुनता है वही बोलता है. If a child will not get hearing, he will not speak. So the cochlear implant is a very good thing, and we can have a good discussion in cochlear implant sometime later, ma'am. It's like,
Definitely, we'll have a separate session on cochlear implants, how they can be done, how costly is it, who can be helped,
mm,
and what is the population which we need to look at for the cochlear implants. We have had an excellent session with Dr. Ashwini today. Thank you for sparing your time with us and discussing the ear
thank you.
infection and their management with us. We have a small gift for you for sparing your time with us. We have this small little certificate for attending our session. uh, People have been very, very concerned about the fact that a new variant of COVID 19 has been causing some surge of infections in China. Now, I want to urge everybody not to be getting panicky about the new variant, which is the BF7 variant. It is a sub variant of BA5 variant, which is the Omicron sub variant. Whether this is going to cause any kind of problems here in our country, this is yet to be seen. However, I want to tell everybody that the good thing is, the denominator is, we have a population which is vaccinated. Everybody of us has at least taken 2 doses of vaccine, which is very, very effective vaccination. And after the vaccination, we have seen that the number of severe infections has gone down drastically. Now, during the Omicron surge, also, we have also seen only those people who have comorbidities have had problems with the Omicron variant. We all don't need to be getting very, very panicky and causing panic situations about the new variant. Of course, every one of us knows that the best armamentarium or the prevention measure is use of mask, especially in this situation, in this season, when in the winter season we know that we have overcrowding happening both in home environment and in office environment. If you are in a closed space, I urge everybody to use mask and prevent this kind of infection. We have had a recent study where we saw that even a simple surgical mask is as effective as the N95 mask to prevent such kind of COVID infections, including in the hospital environment where people, which were mostly healthcare people, were working in and around COVID 19 patients. So I urge everyone who has comorbidities, if they have not taken their third dose of vaccination, which is the booster dose, they are required to take the third dose, which is going to cause some amount of immunity for any kind of variant. But the best vaccination is actually mask at the moment. So please take care of your health, eat healthy, exercise daily, maintain a good weight, stay away from people in crowded situations. Try and avoid social gatherings where you know that you will be exposed to a number of people who could be harboring any kind of virus, be it flu virus or the COVID 19 virus. But keep enjoying and keep happy. I wish you all a very, very good night. Thank you for joining us here today. We will come again tomorrow with yet another topic on Dr. KK's Med Talks. Till then, we sign off. Jai Hind.
Thank you. Good night.